Welcome back. It's Wednesday evening, May 24th, 2017. I'm Sylvia Masters, your host for tonight's Woman Factor. Joining me tonight is dermatologist Dr. Mark Neal with TGNC and the Dermatology Clinic. The skin is the body's largest organ, and it's important to help take care of it. Dermatologists specialize in the health of your skin, nails, and hair, and can help treat skin conditions ranging from acne, aging, to skin cancer. Joining us today is Dr. Mark Neal with the Dermatology Clinic in Houma. We will be discussing common skin conditions and their treatments, as well as skin cancer prevention tips and treatments. Welcome to the show, Dr. Neal. We're glad to have you with us tonight.
Fantastic. I'm glad to be here.
Yes. So first off, introduce yourself to the audience.
Okay. Well, my name is Mark Neal. I grew up in Thibodaux. Moved around a whole bunch for school, went to LSU for college and med school, did my dermatology training at Tulane, moved back to Thibodaux after, and I work in Houma mostly now. We also work in Morgan City and in the Cutoff area occasionally, and I have a wife that's an internal medicine doctor, Ann Price, that's in town, and I have 2 young children.
So why would someone need to see a dermatologist?
Well, you did a fantastic job introducing it. But basically, we treat any problem of the skin, the hair, or the nails. Really common things like acne, psoriasis, eczema. We treat skin cancer. We diagnose skin cancer and do skin checks. We do cosmetic things too for wrinkles and fine lines and sun damage and things like that. So if it's the skin, it's us.
Now, what are some of the popular cosmetic procedures that you perform at your clinic, the dermatology clinic?
I think probably the most popular would be Botox. I think people are very familiar with Botox. It works by relaxing the muscles, so when you make certain faces, it doesn't make wrinkles. We do a fair amount of filler, where filler kind of restores volume to the face. You actually put it in the wrinkles or where you want to add volume, and it kind of plumps it out. We do lasers for different things, for blood vessels, tattoo removal, dark spots, for reversing signs of aging. One procedure that we started doing that we've gotten really good results with is microneedling. And it works by poking a whole bunch of tiny little holes all over your face, and when they heal up, it's really good for making your skin look really smooth, and it's good for acne scars and getting rid of fine lines and wrinkles too.
I'm assuming that doesn't hurt?
We numb you up before we do it. It would hurt without the numbing medicine, but people tolerate it very, very well.
Now, is Botox, like you mentioned, more common than fillers?
Probably.
Yeah. I've heard about
it. It's easy.
Yes.
People like it.
Yeah. So what are the common medical procedures you often treat with your patients?
Our population has a lot of skin cancer. And so I guess in South Louisiana, everybody works out in the sun and plays out in the sun and fishes. We do a lot of skin checks where we check people all over, and if we find something we're worried about, we do biopsies, and we send it off to make sure it's nothing like a skin cancer. And if it is, we do skin cancer surgeries for people to help them get rid of it. So that's real common. We do other stuff too.
And you mentioned, with skin cancer, actually May is Skin Cancer Detection Month, Prevention Month. What exactly is skin cancer? There
are lots of different types of skin cancer. Skin cancer is by far the most common the most common type of cancer. Luckily, most of them aren't super aggressive. The most common is something called basal cell skin cancer. It usually presents as, it looks kind of like a pimple that won't heal, or a shiny little papule with blood vessels in it. Sometimes they bleed really easily, and they grow really slowly. And we don't worry about those too much because they don't spread to your brain or your liver or your lungs. You cut them out and people do very well. If you leave them alone, they tend to make big ulcers that'll cause problems and go deeper and deeper. Next most common is squamous cell skin cancer. The squamous cell usually is like a red scaly bump or papule. It can start off looking like dry skin or as a precancer, and if it gets thicker and thicker, it can turn into squamous cell. Those can, but you have to ignore it for a long time for it to spread usually. And so most people catch it really early and do really well. What we worry about a little bit more, and it's not as common, but we still see a fair amount of it, is melanoma. Melanoma is what you hear about with your funny changing mole. With melanoma, if you catch it early, people do very, very well. And if you catch it later, sometimes it's already spread somewhere, and then it's very difficult to treat. We have more treatments now for melanoma than we've ever had, but ideally you still want to catch it really early, and so you can do really well, right?
Right, no,
Right?
of course. So are some people more likely to get skin damage from the sun?
Absolutely. We see more skin cancer in people that burn really easily. The people that always burn and never tan, that can burn in like 10 minutes. A lot of our redheads and our really fair skin people. People with really light eyes sometimes can burn a little bit easier. Some people have a family history of skin cancer. If you have an organ transplant or you're on chemo and your immune system's not what it's supposed to be, a lot of times that makes you a little more prone to skin cancer too. And so if you're in any of these groups, we like you to kind of keep an eye out for it.
Of course. Now, what are some risk factors of skin cancer?
It depends on what kind, but a lot of them are, a family history definitely matters, like we mentioned earlier. If you burn really easily, like skin type, that's a risk factor. People that are out in the sun more, I mean, sun's causing most skin cancers. Every now and then we see one in a covered area, and there's viruses that can cause them, but mostly it's ultraviolet exposure from the sun or tanning beds and things like that. So we don't want you to get burns. We don't want you to go in the tanning bed. We want you to do everything you can to prevent that sun exposure so you have the lowest risk possible for skin cancer.
And you mentioned not doing tanning beds, getting not so much exposure to the sun. What other tips for people to reduce their risk of skin cancer?
A lot of it's covering up. We want you to wear hats. I want you to wear sunglasses too, because you can actually get cancers in your eyes, but it can cause other problems too. So sunglasses will make you look younger too. Sunscreen, long sleeve, hats. Do the things you want to do, but do your best to avoid the peak sun, and that'll work really well. We like a sunscreen that's an SPF of at least 30. Most of them have good UVA and UVB protection, which are the types of ultraviolet light that cause skin cancer. So I tell people, find one you'll use at least a 30. And just different people like different kinds of sunscreen.
Right. And so what you mentioned earlier, skin exam. What exactly is a skin exam?
You can do skin exams at home. If you do a skin exam, we kind of talked about the warning signs for basal cell and squamous cell and melanoma. If you do a skin exam at home, check everywhere. If you live with somebody and you can't see your back real well, get them to check you too. We like you to do it kind of on a regular basis, and if anything pops up that you're worried about or you think is new or changing, it's always better to be safe than sorry and get it checked out, because if you catch something early, you tend to do a lot better.
So when somebody, performs a skin exam on themselves, when should they visit a dermatologist?
If you have a spot that's growing real fast, anything that's painful, it doesn't have to be painful, but anything that's painful, things that bleed very easily, spots that look like a pimple, they just won't heal, thick red scaly bumps, and with melanoma is the one we want to catch the earliest, a changing moles. We use a mnemonic, we call it A, B, C, D, E, that we look for with changing moles. A is asymmetry, so if one side of the mole looks different than the other, that's a warning sign. B is border. We like a nice crisp border, and to tell where the pigment starts and stops. You don't want to see it faded. You don't want to see like a big scalloping of the border. C is color. We like it uniform brown or pink. We don't want blacks in it. We don't want reds in it. We don't want whites in it. D is diameter. If you're born with a mole, that one's a little bit less important, and we put an E on it for evolving. If you think the mole's changing, it's probably best to get it checked out.
And so, speaking on behalf of a lot of women, you mentioned, sun exposure can cause signs of aging. What can women do to prevent signs of aging?
Sunscreen all the time. It's not exciting. People don't get excited about it because it's more preventative, and people want to do something and see an immediate change. But if you had two versions of yourself and one of them started wearing sunscreen for years and the other one didn't, you would see a huge difference, because it prevents aging. It doesn't actually reverse what you're already, actually your body can reverse some of the sun damage you have. We talked about our sun protection with hats, and that helps too. Sunglasses helps with that too, because you don't squint and you don't make those lines deeper. That helps. Hooray. If you want to try something over the counter too to reverse aging, retinol products are very good at reversing aging. You can use, there's lots of retinol products available. You can even use, there's one that's on the market that was prescription a couple months ago. It's called adapalene, that is now over the counter for acne, but it would probably help with signs of aging too if people want to do that. Alpha hydroxy acid products kind of smooth out the skin. That's like salicylic acid and ammonium lactate can help with that, and make your skin look a little smoother too. So
very important information to know. So how can people contact you if they would like to be a patient of yours? Where are your locations, phone number?
Yeah, you can call our office at 868-1810. We actually, if you're worried about skin cancer, we have a free skin cancer screening this weekend from 9 to 1. It's convenient. If you have a high deductible or you're nervous about something, don't have insurance, or you just don't want to pay your copay, we would love to see you. You can call that number and make an appointment.
Well, unfortunately, that's all the time we have left for this segment tonight. Thank you so much, Dr. Neal, for joining us on the Woman Factor.
I appreciate you having me.
Yes.
Thank you.
And I'd like to thank our guest tonight from TGMC, Dr. Neal. To schedule an appointment with Dr. Neal at one of his locations, call 985-868-1810. Don't go away. We'll be right back after this short commercial break.